For the next 2 to 3 weeks while your final crown is being custom made by the dental lab, the following care instructions should be followed. To help keep you comfortable and reduce any inflammation, take your prescribed pain medication as directed. The underlying prepared tooth may be more sensitive because the temporary crown has not yet fully bonded to it. Avoid extreme temperatures, heavy chewing, and sweets. It is very important not to bite with your temporary crown. Instead, cut up your food into smaller bites and chew with your back teeth, avoiding the side with the crown. When brushing your temporary crown, use a gentle motion and do not floss around it. Otherwise, you may end up pulling the temp right off. Should your temporary crown come off, call the dental office so that the temporary can be replaced or reseated. If you're not able to get to the dental office right away, temporarily put the crown back in place with an over-the-counter denture adhesive or Vaseline and see your dentist at your earliest convenience.